So I think I saw two key insights that were really important to me. I was there as a patient, so as a person who's a frequent flyer in the healthcare system, and I think that the first thing that I thought the key insight was that there's acknowledgement that we're all now technology enabled healthcare experts, and that we have this lived experience, mostly due to the experiences during the pandemic, and that we are in that sense equipped to take part of the dialogue in integrating healthcare technology into the system. And the second one was this recognition that people are tired of band-aid solutions and realize that they don't work anymore, and that there is a way for technology to be used to help us move forward into a system. We talked a lot about primary care, which for me is the biggest healthcare crisis that I faced in my life. And I just thought that it was really encouraging that all of the people who were talking and who are experts in this area all acknowledge that. And I think that the way forward, the way that we're going to move forward, is going to be one where a patient, caregiver, and the public outcomes are going to be like central to whatever transformation that we actually that we actually create for the system. So I would say we've only just begun. So we need to have these conversations now with a diverse group of Ontarians. And when I speak about diversity, I mean age, gender, geographic diversity, ethnicity, socioeconomic status, and we need to ask them and what's important to them in the system, and how can, what part of technology works for them, doesn't work for them, what are their concerns, and that's the way that we need to move forward. And I think that we can only do that by having dialogues with them where the information is provided to them in lay language that they can understand, and actually have a meaningful conversation, and then really do some really good reports on what we've heard, and bring some of those people to these bigger tables to represent the voices of all of the Ontarios that we've spoken to. We've used that approach in other dialogues, and I think it works really well. And it's I think it needs to be done like very soon, and I hope that they're going to be putting that on the table.